Hi, I'm Katie Kramer, President and CEO of the Betcher Foundation. Welcome to Colorado Leadership Stories, where we talk to everyday, courageous leaders who have made transformational impacts in their communities and are building a better state for everyone. You'll hear from leaders and organizations and communities throughout the state as we explore the idea that leadership is an activity that anyone can do. Today on Colorado Leadership Stories, I'm joined by Deidre Johnson, an inspiring leader whose work at the Center for African American Health is transforming lives and communities across Denver. Deidre and I actually go way back. We were both pregnant with our sons at the same time 20 years ago, and it's been a joy to watch our journeys unfold, both as mothers and as leaders in this community. Deidre's story weaves together a deep commitment to health equity, a passion for uplifting community voices, and a vision for building lasting change. Under her leadership, the Center for African American Health has grown into a vital resource, expanding its reach, opening a new community hub, and forging partnerships that bring hope and opportunity to thousands. We'll talk to Deidre about her path to leadership and the challenges and triumphs of advancing health equity. Deidre, welcome to Colorado Leadership Stories.
Thank you so much for having me.
Well, we're excited to dive in. But before we go into all about your professional career and such, I wanted to go back to the beginning. I know that you're a Denver kid, right?
I am. I'm a daughter of Denver.
Oh, we want to hear all about that. Tell us about your early experiences and years and your family and community.
My father was a mathematician. He passed in 2014. My mother is a retired nurse. And they actually met in Fort Sill, Oklahoma when they were in the Army. Got married at Cured Yars. And voila, along came Deidre. You know, what's so interesting about it is I had a wonderful childhood just growing up in Denver. I miss those places like Celebrity and the Crest.
Yes,
and all
Celebrity Sports Center.
I know you could just spend the entire day there.
You could. I can actually sing the jingle. I'm singing it right now in my head. Absolutely.
I've got a younger sister named Nicole. She's 8 years younger, and both of us attended St. Mary's Academy.
Yes.
So K-12.
Right.
Which I think they still do it. When you graduate, they always give awards, the Shepherdess Award, if you've been there the longest. So we both got the Shepherdess Award and dedicated it to our dad, he was an entrepreneur, but he would always take time off in the afternoon and pick us up. We needed to be out there on time, but
right.
he would pick us up and take us home and then go back to work. So my father was from New Jersey, my mom from Omaha. They moved out here. He had very much a pioneer mentality. Mm-hmm. And I remember him saying the reason he liked Denver was there was so much opportunity just to kind of create a pathway. And so he was the first African-American head of the CU Boulder Computer Center. And during that time, my mom took off work while I was here until I was 5. And then again, when my sister was younger. So I really had a nice little bubble that I grew up in. I will say, so I grew up, they call it now Hilltop. Our family, specifically my father, broke a covenant to move us there. So that was very interesting because it was supposed to be a neighborhood in which African Americans could not live. But I just remember him being very deliberate with me. My sister wasn't born yet. I was about 6. And he said, some people have a problem with this, but this has nothing to do with you. Like racism is their sickness. You just go to St. Mary's and be the smartest little girl in the room. When I look back now, he was a great dad, but he always took a very asset-based approach to life. I think part of it's because he was an entrepreneur, but he never talked about barriers or allowed us to see barriers. I could not say I was bored because then that would become that means you need to
right, exactly.
figure out what you need to do.
Yeah.
There's no time for that. But I think, as I ponder of who I've become and as I walk through the world today, I'm Harold's daughter for sure. Like to know me is to know a good percentage of him. And I'm very proud of that.
I love that. Well, I do know part of the story is that you did a little bit of walkabout outside of Colorado for a while. So tell us what you did, and then we'll talk about when you came back.
Oh, I did. Graduated from St. Mary's Academy, went to Princeton for my undergrad. So back in the 80s, I was actually couple years behind Michelle Obama. And that was fascinating because I left St. Mary's, which was very affirmative when you think about an all-girl space, and went to Princeton, which was, although it was a good experience, very male-dominated. So when I think about the challenge there, it wasn't actually so much being a Black student, it was being a female.
Oh, that's
in a space where there'd only been women for about 10 years.
wow.
Yeah. So that was interesting. But I think there's so many things that happen in college where you're just growing up and finding your way. After that, I came home for a year, worked for Dad. And actually, I worked for him when I was in high school. So he had a computer software company, and he'd created a fourth generation language called DD Query. And we did a lot of, it was a relational database. So we did job costing, different accounting systems. In fact, University of Michigan used his system for about 25 years until they retired it. And so even while I was in high school, Turner Construction probably didn't know this, but I actually wrote the code for the work that we did for them.
Oh my goodness.
So that was fun. It was just a fascinating experience to be given that responsibility and then trusted to follow through on it.
Right.
So yeah, I graduated from Princeton, came home, worked for a year with him. Then I went to the Yale School of Management.
I'm sorry, the Yale School of Management. I just
Yale-
want to make sure people could hear that. Princeton and Yale. Okay, go ahead.
Yale School of Management. Back then it was the Yale School of Organization Management.
Yes.
But yeah, I graduated from there. And then I did some interviewing because for a hot minute, I thought about being in equity research until I thought about not doing that. And I worked with him actually for another 7 years. That was a fantastic experience. Had the opportunity to live in Minneapolis for 2 years. We were also in Vancouver, British Columbia for a couple of years. And one of the things I really loved about him was sometimes he would just up and go. Like, you know what, there's an opportunity here, let's go explore it. And so you create this muscle of just going to a new place. My sister 3 years ago moved to Portugal. And I remember folks asking her, well, like, what if she doesn't like it? Oh, if she doesn't like it, she'll leave. But she's like, I'm going to go here, see what I can work out. And, loves it so far. And even with my sons, I encourage them because you kind of build this muscle of, I wouldn't call it fearlessness, but you're just
some risk taking, right?
Yeah. Because, the worst that can happen is you come back home.
Well, that's right. Change your mind.
Exactly. And then while it was great working for him, very type A personality. And so I got to the point where, you know what, I want to do something different. And I want a little more distance. But I had great experiences. I'll never forget one time. He sent me in a room with a contract and he said, do not leave without this being signed. So on the one hand, I was terrified of this discussion, but I found that inner voice. And, in a couple hours, I walked out with what Daddy wanted. So I came back home. My mom was still here and decided to do something totally different. And so for a while, I did a lot of volunteering while I was figuring things out. And then I decided that if I can sell a $30,000 software package, I can sell a good cause.
You can.
Yes.
Absolutely.
And so my first development director position was at the Colorado I Have a Dream Foundation.
Oh, yes.
And I loved it. And what I've always loved ever since then is just driving resources to where the need exists. And it's funny because people will say, oh, you're so entrepreneurial. Part of it is because I was raised by an entrepreneur.
Right.
But that kind of find a need, fill a need, like meet that need, I think is similar in both sectors when things go correctly.
Right. Well, I think about with everything that you did that prepared you to do what you're doing now. So when you reflect back on that, tell us what you studied in college, but other experiences besides working for your father. What were some of those things, experiences, education, those types of things that led you to be prepared to do all this wonderful work in community health and equity specifically?
It's interesting because when I first entered the nonprofit sector, he thought I was going through something. Let me know when this is over so you can come back. Right. But I really enjoyed it. And he was the one that raised us that it's so important to give back to community.
I love that.
Even though we kind of grew up in Hilltop, he was friends with Daddy Bruce, James Johnson, Troy Jackson, like all the different Black entrepreneurs were friends of his. And so we would always visit or kind of be in their orbit. And so that love for community and connection, I was really raised with it.
Mm-hmm.
I think the great experiences I had in both Princeton and Yale was really kind of losing and then finding my own voice. So I majored in English, but I started out as an engineer.
I did too. Yeah.
And I remember being in a physics class. A question had happened. I answered it. And it was like I hadn't said anything. But a guy says the same thing. And like all this praise. I'm like, okay, this particular professor is acting like Deidre's not in the room. But, it turns out he had opinions about Black women even being on campus. And so I think for a minute you do have to be introspective and regroup. So I knew how to program by the time I was 8.
Oh my God.
And I remember taking a C class when I was a freshman. And I was just so stressed out because the professor, I didn't understand what he wanted. And so I called Dad and he's like, you've done this before. And he just reframed him like, oh, okay. Mm-hmm. So I got it and the program worked the way it was supposed to. But because I didn't do it the way he wanted, that was an issue. Mm. And I think one of the things I've always embraced, and it came in handy when I was a program officer working with a variety of grantees, especially as someone managing professionals. For me, as long as you know what that finish line is, there's a multitude of ways to get there.
Absolutely.
And so to be so narrow, like you must do it this way, you're going to miss out on so many rich opportunities, some that might be a lot better than what you could think of on your own. Mm-hmm. And so, I'd have to go back and say that's where I kind of picked that up.
Right.
Like as long as the program works, who cares about the minutia as long as it's as efficient as possible?
Well, I want to turn to the Center for African American Health, which is just such a wonderful place, and we've been proud to support over the years, but such a rich history in Denver.
Yes.
Evolving from a network of churches to a leading resource center for the community. So looking back, tell us a little bit about it, the history and how things changed for the organization. And then I want to talk about your journey there.
So we were founded in 1997. Our founder, Grant Jones,
yes,
at the time he had been a program officer at Piton.
Oh, I didn't realize that about him. Yeah.
And so he had gotten support from Sam Gary as well as the Ford Foundation.
Right.
Just to start seeing what could be done with churches to help community.
Yep.
And so we started out as a Metro Denver Black Church Initiative. And what a lot of folks don't realize is we were doing mini grants, little small mini grants to churches to work on different projects. So it might be an after school program, a health program, a health ministry, working with children of incarcerated parents, youth programs, you name it. In 2005, and I think it was after some experience with the Rose Foundation's Boost program, where you really kind of dig deep and decide what you want to do next, the board decided to become the Center for African American Health, to really zoom in on health specifically. And so for 10 years, we focused on chronic disease prevention and management and senior programming. Around 20, so I had known Grant, especially when I was at the trust, and I had never had him as a grantee, but I always knew about the work and would visit on occasion. And so I left some changes happened at the Colorado Trust in 2014. So at the time I was doing some consulting work. I'd been asked to work by Danielle Varda on her research team. She was with Colorado School of Public Health, and we were actually in Baltimore doing a research project on how could the foundations in that city support economic integration. So it turned out that everybody leaving prison went into 2 zip codes. And so they're really zooming down and, okay, yes, you want people trained, but you don't want someone to have 38 certificates. They need a job that has a future. And so that was fascinating. That's actually what I was working on. And I got a call from a board member saying that Grant had decided to retire and would I be interested in applying? It's like, oh. And it's so interesting because it had never occurred to me to be an ED. My plan was just to kind of consult because I loved the freedom and the variety. But the moment I thought about it, I knew all the places we could be, but weren't yet. And so I said, okay, that would be a nice Rubik's Cube.
Right.
And started December 2015. So ironically be 10 years.
Yes, coming right up on that anniversary
coming up,
for you.
which is wild, but wonderful. And so I have to say, I inherited an organization with a deep community history. And so many of especially some of the seniors and the nurses who helped him found it are still involved. And that's wonderful.
Oh, that's wonderful.
And then the nice thing about it is I had come from that kind of the child health space. And when I was at the trust, I was doing all the grant making around children's access to health care and health coverage. And so really talking to the board, and what they wanted to see was, rather than waiting to kind of help somebody manage a chronic disease, what if we did more to just prevent it to begin with? And so we just slowly started changing the model. And I'd say the very first thing that we did that was new was I had talked to Grant, and he told me in 2011, we had done a survey and we had 2,000 respondents for a Black Health survey. I thought, well, that sounds interesting. We should do that again. Then I contacted the state, and the most they'd ever gotten was 200. And so what that told me was it depends who's asking the question. So one of the first new things we did was really to start collecting our own data, because over the years I'd always been very frustrated, because usually if you ask what a particular community of color needed, you'd be told, well, the sample size is too small in Colorado, but let's take the census data and make some assumptions. And I was tired of secondhand data. And that was a great project, which it's on hiatus at the moment, but at its height, we had 1,200 folks enrolled, and we just did mini surveys. In fact, during COVID, the state contacted me. It was Gretchen Hammer at the time, because she was in the midst of that ground zero COVID, figuring out what we're going to do. And they had put out a survey, but only very few African Americans had responded. We replicated the exact same survey, and within a couple of months had close to 600 responses. So kind of more and more data. The other area, which has always been close to my heart, is early childhood. But I also didn't want to just dive into the deep end. So we take a 2-gen approach, and sometimes I say 3-gen, because we have some grandparents who are taking care of their kiddos. And so we've got wonderful parenting programs, and some things just happen organically. So we started out with a parenting program for couples. The dads wanted something, so we added 24/7 dad. That's grown. And I'm really proud of our barbershop talks. One of my staff started that about, I think this is the 4th year. It meets twice a month. We get about 30 men. They range in age from 24 to 81. And it's really just a safe place for them to support each other, talk about what's going on in their life, look for resources. And it's like just a wonderful brotherhood and peer group. And these days when we need volunteers, they're there at full force. And these things have just bubbled up, which is wonderful to see, because I remember the very first time I did a strategic plan for us, I remember someone telling me that, well, if you do all this surveying of community, they're going to expect you to do what they ask for. I'm like, well, yeah, that's the goal. But it's funny because sometimes it's not. And so I'm very proud of the fact that we inherited an organization with a long, rich history. We've been able to build upon it. And even though we serve more than seniors now, we never lost that population as being important to us. And in fact, when we first were expanding, we did focus groups with seniors, and they wanted to know, what are we going to do for kids? What are we going to do for moms? So, from their vantage point, they see the whole community and how important it is. And you mentioned the building. That bubbled up as an opportunity as well. I remember Grant telling me that he'd always wanted to try to find a building, but it was hard to just the financing and you name it together. And then she's passed away now, but Jerry Grimes, who was the leader of Hope Center, she had been on my board at the time. And she was also part of the HARP Holly Area Redevelopment Project leadership group. And that's when we learned that Roots was going to be going out of business and the building would become available. And it was such an interesting process because you had to put a bid in. There were 5 nonprofits, 3 got accepted, and then you had to present in front of the community. 1 pulled out because they found a building elsewhere. And it was us in a charter school. And I'll never forget, it was April 8th, 2019.
Specifically. Yes.
Specifically. Because we did this PowerPoint. And I just said, if we have the opportunity to be in this building, this is what we'll do.
Mm-hmm.
And what was so fascinating is we were up against a charter school. The community definitely didn't want another charter school. But the way this organization came and really condescended to an audience as if they didn't know what they were talking about was unfortunate. But I just had one of those moments of, we've got this. I just need to sit back and be quiet and answer a question if one comes along. But yeah, they chose us. And then the issue was, okay, we got some money to raise. And really it was with philanthropic support, including Betcher, we were able to pull that off. And we initially moved in with a lease to own January 28th, 2020, right before COVID and the world shut down. Mm-hmm. And then we were able to purchase it June 7th, 2021.
Oh, wow.
I think it's the Gemini in me.
You get a knack for very specific dates. So this is the Hudson Street facility that you're talking about. And so what happens there? Like if you walk in, what would we see?
So the other exciting thing, it was a former school. And so we were able to renovate the first floor. And so keep in mind, in our old building, we had 8,000 square feet. Now we have 21,000. Mm-hmm. Not that we need the whole space, which is beautiful, but we're upstairs in offices. Downstairs, you walk in, we've got a nice lactation space for community members if they need it, which is also nice because we have a perinatal program. So kind of walk in the talk. We have 3 different community meeting rooms. And so we hold classes there, or we allow people to rent them out for events or different sessions. We are about to rent out 3 small office spaces that small nonprofits can use if they need it. I'm very proud of the fact that we have a clinic. And so we're about to have our 25th annual health fair in March. And we'd always done screenings with partners, but they required us, it was event oriented, like, oh, we're doing this prostate event or this health expo. And I wanted us to have a space where 365 days a year, any time of day, we could just do what we wanted. And now we have that. And so we've got 3 consult rooms. We go and it looks like a little doctor's office. And just as I was trying to think about, okay, how are we going to activate this as efficiently as possible, Dr. Oswaldo Granardo, who's a former board member and a family practice physician, stepped forward and said he'd like to partner. And so we're able to provide free acute health care every Tuesday from 5:30 to 9. And that was just a huge game changer. Not only because it gave us time to still figure things out about what the model will ultimately be, but to have such a wonderful partner and friend drew it even more attention. So I have probably about 20 providers that would love to help out. I'm just working on, we need that infrastructure so it's smooth. And we weren't trying to become a big old clinic. It was just we wanted to be a robust program. And so thinking that through. And then we have a teaching kitchen, which is wonderful. We started with cooking. Our class is Flavors of Us, Kids in the Kitchen. And so this summer we've been doing cooking classes for kiddos. Our perinatal navigator also just did a mommy and me cooking class. And later this month, they're going to be doing a cooking class on making baby food. So we're getting more practice that now that we have different things happening, kind of braiding those programs together. We've always done, since COVID, we've done a lot around mental health, and that's been growing. We partner with the Therapist of Color Collaborative. Since we started, we've helped over 500 people. And what's so beautiful about it is we're really proving that if you match someone with a therapist that reflects their background, the stigma melts away. They go to all their sessions. Like, that success is so much greater.
Deidre, it's amazing what has happened in the last 10 years under your leadership. Please reflect for us. Like, what are you most proud of? And I think the other question I just want to ask that's kind of part of that is the right leader at the right time. So clearly you have been. And so when you think about like what's made you successful?
Well, thank you for that question. Last month, I invited Grant over because I wanted him to see the renovation. And we were talking and we were getting ready he was heading to an event. And he said, what you've done has been really extraordinary. And to have that come from the man who created it,
Yeah.
that just warmed my heart and gave me goosebumps. What keeps me going, to me, it feels kind of mundane. Like I always have things in my head.
Mm-hmm.
And so when I interviewed, I did a PowerPoint about these are the things I would do.
Mm-hmm.
And everything we've started was in that PowerPoint, like parenting classes. We need to do more advocacy. And so I've just been working on my Rubik's Cube.
Mm-hmm.
But the things that really touch my heart, especially these days, there have been folks that have called us the Black 911. One day we had a grandpa, he was coming through, and he was coming because we were doing a holiday giveaway. So I can't remember if it was Christmas or turkey meals for Thanksgiving. But in what my staff and I always try to do in that one conversation, get as much information as you can. So although he was coming for the dinner, we talked to him and find out that, he's got his 3 grandsons, about to lose his apartment. And it just so happened, because we were still in that COVID-y time,
right,
that we were doing financial assistance. So we were able to help him with that as well as other things. I think at the time we were also still doing the energy outreach assistance. So that we can be a place where folks know that we may not have exactly what they need, but we make sure we'll do our best to get them what they need. And the other thing I didn't realize until I started doing this work, Black people in our community are often treated horribly when they interact with systems. And we have a space that no matter who you are, we've been over backward for our customer service. Like we may not hit it out of the park 100% of the time, but anything we can do to make people feel welcomed, to make them feel not judged for why they're there, and just that we're here for them because they really are the beloved community. That does it for me. And I remember I was talking to someone at Aspen Institute because I'm a Colorado fellow. And I think that's the thing. I get so involved in the task that I don't step back. But she said something so wonderful because she said, you know what? You really are proving what can happen in the nonprofit sector when you kind of get outside the box. Mm-hmm. Because some people have told me, oh, well, if you do this, you can't do that. Mm-hmm. If you do this, you can't do that. And why not?
That comes back full circle to me, friend, when you're talking about being raised by an entrepreneur. You just have that mindset to be creative, try things, take some risks, but all centered on community connection, service.
Yes.
It's
because line of sight is always that community member. It's not about, does this meet my need or staff need or building need? Are we meeting the needs of that community member?
Right. So for listeners who may be interested in learning more about Center for African American Health, what are some ways they can get involved, find out more, make an impact with the mission?
So our website is www.caahealth.org. We are also on, I need to get better with my social media, but we're on Facebook, Instagram, LinkedIn. I think we have a Twitter. I'm not on Twitter, but I've got some younger folks on the team that are helping us be a little more nimble there.
Yeah.
And feel free to stop by. March will be our 25th annual Health Expo. And we usually get well over 1,000 people. Mm-hmm. And it really is, it's kind of like a party, but you're picking up resources about health. You might be learning how to line dance or tasting good food, but really everything you need to be as healthy as possible. Because ideally, they say only about 20% of your health has anything to do with you seeing a doctor. But do you have access to food? Do you have social connection? Do you have a place to live? Mm-hmm. Do you have a job with a living wage?
Right.
So anything we can do around those social determinants to keep people as healthy as possible.
That's where it's at. We'll do this last question. You kind of are alluding to it, and then we'll get to the lightning round. But when you think about your vision for the Center for African American Health, or just advancing health and well-being, frankly, in Colorado's African American communities, what excites you?
I'm excited by the things we're doing that are new.
Yes.
Partially because, and I'll say this with regard to my overall journey. I come from a community where oftentimes there's a perception of lack. And I don't mean just that one lacks resources, but you might not think you're deserving of more. And I think just because of how I was raised, I flipped that on its head. And I must admit, working philanthropy put me on turbocharge because there are so many resources out there. We might have to fight for them more because there are disparities across the board. But if we're not able to do something, it's not because I don't think we don't deserve it. It's something that we need to maybe strategize with others to make happen. Because as proud as I am of what I've accomplished, none of this would have happened without different people being on Team Deidre.
Mm-hmm. Isn't that true, though, of life? Like, we stand on so many people's shoulders.
Yes.
That have been mentors and collaborators and friends. And it's been a pleasure being on this journey with you. I mean, we've been in the biz for a long time, and it's been so fun to see you there, just holding the mirror for you, friend. It's you just amazing.
Thank you.
Yeah. All right. Well, I will wrap up with just 4 quick questions for the lightning round.
That was fast.
I know. It just goes so quickly when you're visiting. Okay. First of all, what's your favorite Colorado hobby?
Hot springs.
Nice.
My favorite one is, because I need my hot springs hot.
Yes. Oh.
So my favorite one, it's about 20 minutes past Winter Park, Hot Sulphur Springs,
yes.
Hot Springs. That's my favorite.
Thank you for saying that. I think that deserves a big shout out because there's a lot of other hot springs that you think about.
They're always hot.
Yeah, but that was real hot. And I don't know that a lot of people think of that immediately when that comes to mind. So good. That's great. That's great. Okay. Favorite Colorado landmark?
Ooh, Red Rocks.
Mm-hmm. Oh,
I tend to,
right?
Yeah. I tend to typically just go for concerts. Mm-hmm. Sometimes I imagine myself running the steps, but that's not happening.
I want to do that too. Or just go to a concert.
Exactly. But yeah, it's just beautiful. And so whenever someone visits, no matter who's playing, I'll make sure they get there to see it.
Yeah. Special place. Okay. Action hero you most identify with?
Wonder Woman.
Yes, absolutely.
Yeah. Plus, I love the show. I used to watch it when I was a kid.
That's right. The one with Linda Carter.
Yes.
Yes, of course.
That's the only one, right?
I know. I think so too. That's great. Okay. And then what are you currently binging? Is there a show or a book or a podcast that you're enjoying?
Show-wise, I just finished The Pit.
I don't know about that one.
I remember, I think it's Noah Wiley who was on ER. Mm-hmm. Well, he's got a new one on Max. It's called The Pit. And it's really, it takes place over a shift and a hospital ER in Pittsburgh. Mm-hmm. And anything you can think of happens during the shift. It's fascinating. It's funny, I'm not a big mystery person, but I love British cop shows. So starting with Luther with Idris Elba, I think that's when it started. So I include BritBox in my subscription.
I love that. I did not know that about you. Learn something new every day. Oh, that's great. Well, thank you so much for coming in and
thank you for having me.
It was
this great. It's been a joy.
Great to visit about the journey and have such an appreciation too for your wonderful parents and the influence of your father in your life too. So that's great. You. I loved hearing about that today. You're Harold's girl.
I am. Harold's baby.
Yeah. Thanks, Deidre. Thank you for joining Colorado Leadership Stories, where we hope to inspire the next generation of Colorado community builders, doers, and difference makers. Colorado Leadership Stories is presented by the Boettcher Foundation. The Boettcher Foundation supports Colorado by empowering leaders and communities with tools to tackle challenges and pursue opportunities, building a better state for everyone. With an 85-plus year legacy of giving back, we're committed to amplifying our impact for future generations. That's the spirit of Boettcher.